Mr. President, I want to talk about the issue of cutting costs. I'm a doctor, and when I go into my office, there's the issue of doing good for the public, okay, by cutting costs, and otherwise we're going to all go bankrupt. And then across that desk, there's the patient, and he's looking me in the eye, just like you're looking me in the eye. And God forbid if he should have some kind of advanced cancer that he wants to take an experimental drug for, but the insurance company won't pay for it. Ultimately, is there a limit to what the healthcare system can pay for?
Well, I think that what we know is that right now there's a whole lot of care that's not improving health. And my main focus is on how we can stop putting money into things that aren't making people healthier. We're going to get situations where, something would potentially make somebody better, but it's very costly. The experimental cancer drug, the case you just pointed out. And we're going to have to make some difficult decisions as a society about that. But the problem is, before we even get to that question, we've got 15, 20, 25% of our costs that are going into multiple tests that don't get distributed properly. So somebody's taking 5 x-rays instead of 1 x-ray. We've got situations where somebody's getting a brand name drug when we know from every single study that a generic would do just as well. Those are the situations that we should immediately be focused on. And I think if we reform that part of the system, we save huge amounts of money. That drives down costs for all families, and it drives down costs for businesses and government. Then we're still going to have some tough questions as we get older about how much more money we want to put into healthcare as a society. But right now, we're just wasting so much we don't even have to wrestle with some of those more difficult ethical questions.
Let's talk about how you get rid of unnecessary procedures. You've said that if doctors have the information, they'll do the right thing. And generally, I'm a physician, I'm practicing, I like to think that's true. But actually, there are a lot of times when that's not the case. For example, angioplasties, elective angioplasties, where you open up a clogged artery in the heart. It turns out that about 30% of them are unnecessary. That they're done and you're trying to open up an artery to the heart, but really it's no better than medication. And doctors know this, but they still order them.
Why are they still ordering them, do you think?
I don't know. I think that because they believe there's this thing about if an artery is closed, it's got to be better if it's open. And it turns out that's not true. So they have on the one side their intuition as a physician and their belly, and then there's the evidence-based medicine that we talk about. And they clash a lot of the time. So how do you make that doctor do the right thing or give them the right incentives?
I have enormous faith in doctors. I think they always want to do the right thing for patients. But I also think, if we're honest, doctors right now have disincentives to making the better choices in the situations you talked about. If you are getting paid more for the angioplasty, then that subconsciously even might make you think the angioplasty is the better route to take. And so if we're reimbursing the physician not on the basis of how many procedures you're performing, but rather how are you caring for the patient overall? What are the outcomes? Then I think you start seeing some different choices. And at the very least, you're not taking money out of physicians' pockets for making the better choice. So it's a combination of better information, and then I think a different system of reimbursement that says, let's look at the overall quality of the care of the patient.
Let's talk about the end-of-life kind of decisions. You've gone personally through some very difficult times with your grandmother. She had cancer, she broke her hip. That must have been very difficult for you. I mean, what was that like for you to make those decisions?
Well, fortunately, she was alert and cognizant the whole time, so she had to make these decisions. It wasn't a situation where I had to make these decisions. In the end, once she lost consciousness in the last week of her life, let's say, at that point, she had a living will and, again, provided us with some very good direction. She didn't want extraordinary intervention, and so we had a hospice type of situation. That's probably the most important thing we can do on end-of-life care right now, is to make sure that we're empowering everybody to make decisions for themselves about how they want to deal with the end of life, and to encourage people to look at hospices as a legitimate option for dealing with these issues. But you know what? There are going to still be some tough situations, we know we spend a huge amount of money in that last year of life, certainly under Medicare. And my hope is that as a culture and as a society, we're going to be able to have a in-depth discussion, and more people are going to say, I don't want people poking tubes and doing all sorts of stuff to my body. I want to find a way where I can control this end-of-life process in a dignified way that's good for my family. Okay. We don't teach that, though, and we don't encourage that, and that's not the message that's still sent through the medical system. And
so we need a new conversation.
I think we have to have a new conversation about it.
Let me turn the discussion to small businesses, okay? Mm-hmm. Small businesses help fuel the economy. They certainly help drive the engine that can get us out of the kind of tough recession we're in now. But the House bill penalizes small businesses if they don't give insurance, and then it raises the taxes on the owners of those small businesses. So for the small business owner, they're thinking, we're getting hammered. I mean, is it really a fair thing to do to them?
Well, keep in mind that there's going to be a House bill, there's going to be a Senate bill, we're going to have to reconcile them. We don't want to presume that what's in a draft or a version right now is going to be the final bill. I think there are two principles at play here. Number one, if a company can afford it, then it needs to pony up a little bit if it's not providing insurance directly, because the rest of us otherwise are providing insurance through the emergency room to those employees who don't have health insurance. So I think there's just a fairness element. If you can afford it, either give your employees health insurance or pay into the pot so that we're not subsidizing you. There are going to be some very small businesses that just can't afford it no matter what. And what we want to do there is to provide them the ability to pool with other small businesses to take advantage of the healthcare exchange that we're setting up, so that you've got now millions of people who have negotiating power with insurance companies to drive down costs, get the lowest possible premiums. I think that is something that a lot of small businesses want. There was just a story in the Wall Street Journal that small businesses are no longer providing care, not because they don't want to do the right thing for the employees, but it's just too expensive. If we can drive down those costs for them, I think a lot of them are going to choose to get insurance. As far as how to pay for it, the thing I want everybody to understand, because we keep on hearing about this $1 trillion healthcare bill.
Right. We're already deep in the hole. How do we pay for it?
$600 billion of that is not new money. It's money that's already going into the healthcare system by taxpayers for things like subsidies for insurance companies or big subsidies for the drug companies through the prescription drug plan. And if we can take some of that money out and reallocate it in a more effective way that provides coverage to more people, gives choices to more people, I think that's a pretty good deal. Now, on the front end, we're still going to need an extra $300 billion over 10 years, or $30 billion or so. And I think there are a lot of different ways to fund it. Personally, I think the best way to fund it is for people like myself who've been very lucky and are in the top, not just 1%, but top 0.5% of the income ladder to pay a little bit more. My understanding is the House applies some sort of tax to people who make $1 million or more. The Senate may have different ideas, but the general notion that those of us who are the best off can pay a little bit more up front to help reform a system that will save us money over the long term, I think that's a good idea.
Ultimately, philosophically, do you believe that each individual American should be required to have health insurance?
I have come to that conclusion. During the campaign, I was opposed to this idea because my general attitude was the reason people don't have health insurance is not because they don't want it, it's because they can't afford it. And if you make it affordable, then they'll come. I've been persuaded that there are enough young, uninsured people who are cheap to cover, but are opting out, that to make sure that those folks are part of the overall pool is the best way to make sure that all of our premiums go down. And so I'm now in favor of some sort of individual mandate, as long as there is a hardship exemption. If somebody truly just can't afford health insurance, even with the subsidies that the government is now providing, we don't want to double penalize them. And we want to phase this in a way that we have time to make sure that coverage is actually affordable before we're saying to people, go out and get it.
Mr. President, when people hear you talk about a national insurance plan, there are fears of socialized medicine, rationed care, limited choice. How do you handle this?
You know, all I can do is just keep on repeating the absolute promise that I have made, and none of the bills that are being considered in the House or the Senate contradict this, which is if you've got health insurance that you're happy with, you've got a doctor that you're happy with, we don't want you to do anything. We don't want you to change. The only thing we're going to try to do is lower your costs, but you're not going to have to join some government plan. What we are saying is that if you don't have health insurance, if you're underinsured, if your employer can't afford it because they're not a large enough business to negotiate with the drug companies, then we're going to lower your costs. What we're also going to do is make sure that insurance companies are reformed so that they can't exclude you for a pre-existing condition, so that if you lose your job or you change jobs, you can still find health insurance. We want to give security to people because there are a lot of folks out there who have health insurance, but what they don't realize is that they're one job change away or one lost job away from suddenly being in a very disastrous situation. We want to prevent that, and that's what this reform can do.
What do you say to the private insurance companies who say, we can't go up against the federal government, that's just unfair, they'll clobber us, we're out of business?
Well, the private insurance companies have said that if, as part of an overall exchange, we provide a public plan, an option for people where they can go and get health insurance through this public plan, not having to worry that that public plan is charging profit or looking for profits or doing other things that affect their bottom line but may not be good for patients. The insurance companies feel that, well, maybe that's going to be unfair competition. What we've said is, as long as we're not subsidizing that public plan, as long as taxpayers are not paying money out of pocket for it, but the public plan has to survive on premiums just like everybody else, if they're more efficient, if they're providing a better deal, that is going to provide the kind of competition that will whip the private insurance companies into shape. And private insurance companies always say they're giving the best possible deal to their customers. They should be able to handle a little competition from a government that they say is wildly inefficient and can never get anything done.
Mr. President, thank you so much for this opportunity to talk to you.
Thank you.
Thanks for your time.
I appreciate it.